there's a staffing crisis, and healthcare safe staffing legislation will fix it. Let me hear you shout! By the way, for the first time in history, the New Jersey State Nurses Association supports safe staffing legislation! Hi, everybody. My name is Debbie White. I'm the president of Health Professionals and Allied Employees. I'm an RN. Happy Nurses Week to the nurses here. And I do have to give a shout out to the teachers who are here supporting us. We do have Happy Teachers Week. We are here to push our legislators to pass S304 and its assembly counterpart for safe staffing. But before I begin to say anything, I want to give a shout out to the many unions we have here. In fact, I think we have every healthcare union in the state covered. First off, Genesso! The steel workers! $11.99 JSB! NISA! Woo! New Jersey Nurses Union CWA 1091 and CWA 1036. $11.99 SCIU! Fighting for their first contract. Informational picket coming up. And my personal favorite, HPAE! And we have Laurel Brennan in the house, AFL-CIO Secretary-Treasurer. I also want to give a shout out to my fellow AFT Vice Presidents from AFT Pennsylvania, Art Steinberg, and Donna Chiera from AFT New Jersey. They are educators supporting nurses. And members of and leaders from the Central Labor Councils. I know I saw Wyatt Earp. I don't know if Adam's here, Barry, I don't know if he's here, but thank you, CLCs and your leaders. Give me 1 second. So welcome, everyone. Healthcare is in crisis. We here are part of a national movement to address the staffing crisis by proposing state-by-state legislation for safe staffing. Pennsylvania, New York, Connecticut, Maine, Minnesota, Oregon, Washington, and other states have legislation to address safe staffing pending. Only one state has really done it right. Yes, California! We've had 19 years to evaluate the effect of that legislation. Linda Aiken and Matthew McHugh from UPenn, some of my healthcare heroes, because they've studied the effect of safe staffing on patients and nurses. They found this for patients: decreased likelihood of patient death, decreased admissions to critical care, improved patient outcomes, improved patient satisfaction, less hospital-acquired infection, less falls, decreased patient readmission, and one of my personal favorites, less violence. Did you know healthcare workers are 5 times more likely to be assaulted than any other profession? If healthcare workers are safe, patients are safe. Safe staffing not only makes patients and healthcare workers safer, but it causes better retention of staff. Less turnover, which means decreased orientation costs, because you know there's a revolving door. People come in, they leave. They come in, they leave. So in order to tell you the cost factor, in addition to less orientation costs, that better outcomes lead to better CMS reimbursement, less lawsuits, better patient satisfaction, which causes better reimbursement. So, safe staffing saves money. Safe staffing saves lives. Safe staffing can save healthcare. Let's be the first state after California to pass a safe staffing law with ratios. Okay, so we're really pleased to be joined here today by one of the sponsors of our safe staffing legislation, and that is Senator Linda Greenstein. Senator, come up and talk to us.
Stand close to this. Hello, everybody. It's hard to follow some of those wonderful statements that everyone's making and to listen to this great crowd. You are the best. You are the best. And I want to thank you for having me here today. You know, I stand with all of you today to join you in sounding the alarm that there is a crisis brewing in our healthcare system. After the last 3 years of battling a global pandemic, there are lessons learned. The especially important lesson is that we must do more to reduce the risk of harm to patients. And I know we've said it before, but it bears repeating. All of you men and women are heroes of the pandemic, and you're heroes now. You've been taking care. You've been taking. You take care of our mothers, our fathers, our children, and loved ones, especially during the darkest time. And through it all, you stay at their bedside. And like I said, during the pandemic, we couldn't do enough to hail our frontline health workers as heroes. We showed them that we mean that, and we need to establish standards that will improve working conditions at our hospitals. One piece of that puzzle is safe staffing, making sure that our hospitals and healthcare facilities are adequately and properly staffed means that the staff will be well equipped to provide exceptional patient care, and ultimately to save lives. I am one of the sponsors of New Jersey S304, along with Senator Vitale, a bill mandating enforceable nurse staffing levels in hospitals. Now, I can't even imagine the amount of applause on the day it gets signed by the governor. Now more than ever, we need to take meaningful action to stop the exodus from our hospitals of dedicated, courageous nurses and other healthcare workers. That is our challenge, and I will do my best to help you meet that moment by pushing as hard as I can to see that this legislation is passed. Thank you all. Thank you.
Thank you, Senator Greenstein, our sponsor. Okay, next up we have Assemblyman Wayne D'Angelo, who is also the president of IBEW. Give it up for the Assemblyman.
Good afternoon, brothers and sisters. And thank you for giving me a couple moments to say hi. You know, I'm one of the few labor legislators that are here out of the 120 of us. And I know what it's like to fight for the rights of working family. Every day I do it at Local 269, right here for the electrical workers and the building trades. And I stand in solidarity with you this afternoon. And thank you. Keep up the fight. I stand in support of the legislation that Linda was talking about. She's my running mate, in case you didn't know. We're in the 14th Legislative District. And, you know, God bless the unions and have a great rally.
Give it up for the Assemblyman. Next up, we have Laurel Brennan, Secretary-Treasurer of New Jersey AFL-CIO, who came here to be with us today. Give it up for Laurel Brennan.
Hey, how's everybody doing out there? Woo! I am so proud to see all of you out there today standing up for what you know is right. And I want you to know, for decades, and I've been here for decades, we've been fighting for safe staffing for our healthcare system in New Jersey. Understaffed, unsafe staffing levels lead to workplace injuries, we all know that, burnout, and the great resignation of nurses. And the hospitals in New Jersey would not be successful if it weren't for all of you. Remember that. Unfortunately, many of the hospitals are putting profit over people, and the quest for increasing profits is getting more and more prioritized within the healthcare system in New Jersey. And I think that's one of the reasons why this legislation hasn't been passed yet. So, your being out here today makes a big difference. S304 is a win for all of you, our members, our patients, and our communities. After all, isn't that what we want? Healthy and safe workplaces? That should not be a slogan, it should be a way of life. And enough is enough. The New Jersey State AFL-CIO, whom I'm representing here today, our members and our allies stand shoulder to shoulder with you to demand that S304 get passed. We're organized, we're united. Obviously here, this is the best representation of nurses unions I've seen in all the years I've been here. And woo! So we're calling on the legislature to listen to the essential workers, that is you. Remember during the pandemic how essential you were, right? And now they think you're expendable, so we're not allowing that to happen. You are the backbone of the healthcare system here in New Jersey. So I want you to know we are here for you, we are with you, and we will do whatever it takes to make sure that this legislation gets passed. Si se puede.
Dr. Linda Aiken, one of my heroes, said this: all the evidence we have points to the fact that the staffing crisis isn't a crisis in nursing. It's a crisis in hospitals. At HPAE, we conducted a formal survey of healthcare workers. Actually, we asked for all bedside caregivers. What we got were some nursing assistants and some other staff that deal with patients, but mostly nurses responded to the survey. But let me tell you the results, because they're absolutely alarming. 30% had already left the bedside. Of the 70% that remains, 72% want to leave the bedside. That's an alarming statistic. And of those with 0 to 5 years experience, 95% want to leave. You know what that creates? A revolving door. We have a retention problem. We cannot keep nurses at the bedside. The staffing issue, well, did it start with the pandemic? No. Let me tell you something. Healthcare workers were already stressed out by the time the pandemic hit us. Who created the problem? The hospitals. Hospitals made staffing a line item in a budget to be cut down to its lowest, tiniest number in order to maximize what? Profits! Hospitals will never staff up, staff appropriately, staff safely, unless mandated by law. And we will never have nurses staying at the bedside if, in fact, we don't mandate staffing legislation. We have to stop the bleed. If we do not stop the bleed, what we're doing is effectively trying to fill a bucket that has holes in it with water. We recruit and recruit and recruit, and the water won't stay in the bucket. Why? Because the nurses are leaving the bedside. So, I want you to hear from some of our nurses. We have some nurse speakers, and I may end up having, we have 4 or 5 other legislators that may come to our rally. Actually, they have confirmed. They haven't gotten here yet. They might be in a committee, but if they do come, I'm going to interrupt. I'm going to put them in between the speakers. But right now, I want to introduce you to our first speaker, Alice Barden, President of HPAE Local 5004 at Englewood, Allen.
Hello, everyone. As Debbie said, my name is Alice Barden. I'm a nurse. I represent the nurses at HPAE Local 5004 at Englewood Hospital. I've been at Inglewood Hospital for just about 23 years now, and we all know that patients and families expect attentive care from their nurses, and they have every right to expect that. But what they don't know is that the demands that are placed on staff because of unsafe staffing, it makes it impossible for us to meet the expectations of care that our patients have for us. We are set up to fail by our employers who are risking the safety and comforts of patients by understaffing. We already know that corporate hospital employers will not do the right thing for patients or staff unless they are forced to do so. Can we all remember prior to 2002, before mandatory overtime was legislated? We had to get our employers to stop that by doing exactly what we're doing right now, coming out to our legislators and letting them know that we needed a ban on mandatory overtime. Before then, employers said it could not be done, but guess what? Once the bill passed and they were forced to do it, they figured it out. The state legislature and the governor have it in their power to make staffing ratios a reality. And guess what? Employers will figure it out. Current patient loads are unsustainable for anyone. We're hemorrhaging nurses due to the crushing workload that we must endure every shift. Understaffing is a public health safety issue, and it is eroding the patient safety every minute of every day. So, to retain nurses, to keep patients safe, our employers must once again be forced to do the right thing. We need to force them to acknowledge our humanity and the humanity of our patients. Nurses and healthcare workers are not machines. Patients are not dollar signs, and it is time for New Jersey to enact enforceable staffing regulations. Thank you.
Thank you, Alice. Thank you. By the way, did you know not one hospital closed in California like they said they were going to have to? Not one, based on the safe staffing law. Not one. Don't let any hospital employer tell you, but we'll have to close our doors. Not one in California did. Next up, we have the Genesso president and also an RN, Elfrida Johnson.
Good afternoon, family. And I say family because we're all sisters and brothers of the mighty unions. Yay! All right. For 20 years is 20 years too long. It's felt like a game of volleyball with a ball for the vote. To make this bill pass has been stuck in the net and nobody's taking it up. But today we're here, we're presenting it again, and we're not going to stop until we get it. We want it passed. Woo! How many more nurses are we willing to lose? Lose because nurses are fed up, the work is too heavy, patients are getting hurt, nurses are getting hurt. What is it going to take? I'm going to tell you what it's going to take. It's going to take our legislators to do something about it. And we're going to make sure they do something about it. Our legislators that are here today, they know who they are. But when you see yours, you ask them why weren't they here today to support us? Because this bill is important. We're here today, and it's not a game. It's time to put our patients first, protect our nursing workforce, and in case you didn't know, our nurses always put our patients first. Our patients come before anything and anybody. Let's stop playing politics and stop claiming emergency. Yes, we know everybody wants to make money. We know you're in this for profits, but don't put the patients and the nurses aside for that. You want profits? Treat your patients with the best care, with the best nurses, and you will get your profits. Tell our legislators to support ratios and become a co-sponsor of this bill. Do not tolerate the problem. We need to get this bill passed. Yes, COVID changed the world, but COVID did not start with the nursing shortage. COVID exacerbated it. Nurses got fed up, and we're fed up. COVID made the problems worse. So act at the ballot box. Tell your family and friends to do the same thing. Let them know the importance of safe staffing. Why? Because it may be them, their family, or even us laying in bed waiting for somebody to take care of us, and nobody can come in the room to take care of us. Safe staffing works. If you have doubts, just ask yourself. If I'm in a hospital and I had surgery and I'm putting my call bell on to go to the bathroom and nobody's answering me, what am I going to do? I'm not going to go to the bathroom on myself. I'm going to try to get out of bed and go to the bathroom. But when I fall and hurt myself because nobody came to help me, or because I'm in pain and I can't get my pain medicine, whose fault is it? You're going to blame the nurse? No, it's the hospital's fault. Safe staffing saves lives. Safe staffing saves life. Safe staffing saves life.
Safe staffing. Safe staffing. Safe staffing. Safe staffing. Yes. We have another nurse. Okay, next up, we have Doreen Jones. She's an RN from 1199J AFSCME.
Fired up, fired up, fired up, fired up. Listen, this staff shortage didn't just start. It's always been here, but we are going to have a change to that right now. Not yesterday, not tomorrow, today. And what are we going to do about it? We're going to do something about it now. Our families, our loved ones, our communities depend on it. S304 has to pass, and it has to pass now.
Okay, steelworkers, Judy Danella, from President of the Steelworkers Local 4-200. Judy Danella.
Hi, I just want to thank everybody. Can you hear me? I don't know. Am I okay? Okay? Is that good?
Let's try this one. Let's try this one.
Can you hear me now? First of all, I want to thank everybody out here that has come out. I see red, I see white, I see blue, I see nurses. What do us nurses want? We want safe staffing. You hear all the time about California. I think every single corporate leader in this institution will tell you it's failed in California. I am not sure if you talk to any of the California nurses that they will tell you that it has failed. It has worked in California. I don't see why it can't work in New Jersey. This is not a fight for us. Me, I spent 30 years at the bedside, and like I said last time, nobody stays 30 years anymore. I'm an ancient breed, as is probably half my colleagues here. But we need to make it safe for my colleagues, the new ones coming in, and the bottom line is for the patients. It has to start with the patients. If you go into an ED and you are taking care of 9, 10, 15 patients, What quality can you give those patients? You can't. So as the patient goes through to the bedside, to the intensive care, they go through all the way up to the final person they see in case management. Can we give the care without ratios? No. Many of us go to work and we say, oh God, I hope staffing is good today. Correct me if I'm wrong, my colleagues. You wonder how many people are going to be there to help you. And it cannot only be the travelers that they are band-aiding our systems with. It needs to be the nurses that are there, because we need to take care of the patients. How many times have you given better care? When you can actually sit down and talk to your patients. Explain why they're taking the Norvasc. Not just hand them the pill and 5 milligrams of Norvasc, that you can explain why. Safe staffing will cover all of that. And I think it's time in New Jersey, I would like to see before I leave the profession, and even after I leave the profession, I will fight for it to get in, for all of my colleagues, for each and every one of you, and for the patient at that bedside. Support safe staffing.
Okay. All righty. We have 2 more nurses, and then we have a couple other people, and I don't see the legislators out here yet, so we're going to continue with our nurse lineup. Because nurses are the most important people here today, and all healthcare workers. So, next on our lineup, from NJNU CWA, Local 1091, Maria Rafinsky, co-chair. And RN.
Hi, everybody. My name is Maria Rafinsky. I've been a nurse for, wait for it, 45 years. in the same facility, I know. But since I can remember, staffing has been a problem always. Safe staffing ratios are one of the main contributors to the success of any healthcare facilities. At the hospitals where our nurses work, we have been battling with inadequate staffing ratios for years. In fact, little known fact probably, some of you don't realize, we testified here in front of the Health Assembly Committee, along with HPAE and all the other unions. We testified with staffing forms, a stack like this on the tables. And you know who testified also that day? The CNOs and the hospital organizations. And did they testify for ratios? No, they did not. And here we are, almost 10 years later, and we're still fighting. But now is our time. Now is our time. When that bill needs to be passed, we all will be at our level where we can actually give safe patient care. We need mandated minimum nurse-to-patient ratios at all hospitals to stop crippling the nursing shortage and the high rate of burnout. The global pandemic, for the world to see what nurses really do and the highly trained professionals, the pandemic did not cause short staffing. We were critical before the pandemic, and now it's just impossible to give safe care to our patients. Too many nurses are moving on to other careers. I might see a nurse there, and in 6 months she's gone. They can't take the workload that we are given right now. We can't give proper care to 8 patients. It's impossible. We need to continue to apply pressure to our state legislators to pass the bill that would establish minimum registered professional nursing staffing standards for hospitals and ambulatory surgery facilities. And I will end by saying only 4 words. And what is it? Safe staffing saves lives. Let me hear it. Staffing saves lives. Safe staffing saves lives. Safe staffing saves lives. Thank you very much.
Thank you, Maria. So next up, we have another RN from NISNA, Lisa Ruiz.
Thank you. Greetings from Atlantic City, the home of the only New York State Nurses Association bargaining unit, Shore Medical Center. There ought to be a law, right? There ought to be a law. And it's our time to get this law passed. And it's not just from the nurses at this rally and healthcare workers at this rally. It's every nurse, every healthcare worker in the state of New Jersey needs to pick up a phone, write a letter, and call their elected leaders to pass the law. I've been a nurse, a registered nurse, for 32 years. Unsafe staffing existed 100 years ago. It existed 50 years ago. It existed 25 years ago, and it exists today. And why isn't there a law? Because is your life worth a nurse, a good nurse to take care of you 24 hours a day in a hospital? I know my family's life is worth it, but I know there's not enough nurses in the hospital, and when I have a family member in the hospital, this nurse goes with them. And my sister's a nurse, and my nieces are nurses, and they go also. So when you leave here today, you need to talk to every single one of your coworkers, all of your neighbors, and tell them their life is worth it, and we need them in that building to realize their life is worth it, and pass this damn law now. Thank you for coming today.
Is there a Tanya Howard? She's on my speaker list. Tanya, come on up. RN, 1199 SCIU.
Hi, everyone. My name is Tanya. I work at Mass Medical Center in Belleville, New Jersey, and I'm proud to say we're new to the fight, but not the struggle. We just won our union campaign last year in August of 8/22, and we are now currently working on our first contract. So we all know how hard we work. We all know how many hats we wear in the hospital to keep our patients safe. Our credo is first, do no harm, and that is what we do. Everything we do as nurses is to keep our patients safe. And to have this legislation passed, let me just tell you, our lives, our patient lives, our community lives would be so much better, would be that much better, would be that much safer. And I'm proud to be here in this struggle. I'm proud that we won our union bid. I'm proud to be a member of 1199 SCIU. I'm proud to be here with all my brothers and sisters of the other unions. We can do this. We did this. We did this, and the fight will continue. Thank you.
Thank you. Thank you. I see Senator Dignan's here. And he's shaking hands. Senator Dignan's here to support us. Give it up for Senator Dignan.
I know you hear this all the time, but is there anything more important than when somebody is challenged and has a health issue to have proper care? What you are doing here today is just simply common sense. Just keep up the good work, and I do have to say, you know, the old joke about tell me your company and I'll tell you who you are. Senator Vitale is the absolute gold standard when it comes for standing up for what's right, for what's good for our health workers, what's good for our hospitals, what most importantly is good for our citizens, and I'm just honored to be part of this. Keep up the good work.
Thank you. Thank you, Senator Dagnan. FYI, I want to take this opportunity right now. We have two unions that are having very difficult time during negotiations. And I'm going to tell you about two informational pickets you guys can support. Number one, HPAE Local 5138 at Southern Ocean is having an informational picket this Saturday at 12 p.m. Please come out and support. It's in Manahawkin. 10 a.m.? It's at 10 a.m. We also have an informational picket coming up at Claremont for the nurses trying to negotiate their very first contract. I think for those of you who've been there know how difficult that is. And that will be at...
It's going to be this Tuesday from 12:30 to 2:30 p.m. at Claremont Medical Center in Belleville, New Jersey. We absolutely need the support of everyone here. Please come and support us. We're fighting. We are not getting our first contract. And I just want to say that they made a law and a legislature to protect nurses from being harmed. We would not be harmed if we had safe patient staffing.
Is Anna Pona in the house? Give us details of the informational picket. This Saturday. Oh, that's okay. All you got to do is tell them where, when.
So this Saturday at Southern Ocean Medical Center in Manahawkin, New Jersey, Route 72, we will have an informational picket for safe staffing between 10 and 12. Please come and support us. We are in the fight of our lives. Please come and support us. We really, really need your support. Thank you very much.
Okay, two informational pickets. Let's support them. All right. I also want to say, take a selfie of yourselves or a group photo and share your story on social media. Any one of the social medias are fine. Hashtag Safe Staffing Now. Hashtag Safe Staffing New Jersey. Hashtag Nurses Week 2023. Or hashtag Safe Staffing Saves Lives. Okay? Tag. We also need you to tag Governor Murphy, Senate President Nick Scutari, and Speaker Craig Coughlin. It's very important that you tag those people. Next up on our list is my fellow Vice President on the AFT Executive Council and my counterpart here in New Jersey representing education. Donna Chiera is an educator and the president of AFT New Jersey, and she is here to support nurses.
Okay. I was a teacher for 33 years in Perth Amboy. And as I stand here today, I'm watching all these students walk in and out of the tour. And as I'm standing here, I'm thinking that safe staffing is an education right. Because all of those students, even though they're very young, will spend some time in the hospital. And I don't care if they're in Perth Amboy or in, I don't know any really rich towns. But they deserve safe staffing. The thing I now understand is hospitals spent a lot of time during the pandemic talking about their heroes. However, when you got to the bargaining table, you were no longer heroes. You were more or less zeros in their lives. They spend a lot of money making sure hospitals don't become unionized. And the reason they don't want that to happen is why, when they look around today and they see all of you, they realize that union power will make them put people before profits. The thing I don't understand right now is I'm seeing a lot of nurses, a lot of medical people, but I don't understand why we don't have almost every person who lives in the state of New Jersey in this courtyard today. Because this isn't your issue. This isn't my issue. This is every resident in the state of New Jersey. Truthfully, it's every resident in this country. It's their issue. When someone comes out of the hospital, you ask them, the first thing they say was, if it wasn't for my nurse.
That's right.
When people fill out hospital surveys, most of the people base their survey answers on how they were treated by their nurse.
Yeah.
Safe staffing saves lives, but it's Mother's Day on Sunday, and I'm going to tell a very personal story. My mother's not with us anymore. And she was in the hospital, and she took a turn for the worse, so we got a call to come to the hospital immediately. And when I got to the hospital, I was in such a panic because I knew my mother was dying, and I didn't want her to die alone, and I really rushed to get there. But when I got to the hospital, there was a nurse sitting next to my mother's bed, holding her hand until one of her children could get there and be with her. That nurse did not have to do that. In fact, I learned later that that nurse shift ended, but she stayed because she put someone's life. She made sure that someone didn't die alone. She put people before anything else. In fact, she gave up time spending with her family to sit with my mother. Nurses are our heroes. They need to be treated like heroes at their job, not only at the bargaining table with respect. And they're fighting not just for themselves, they're fighting for all of us. So I'm saying we need to stop talking to the nurses. We need to stop talking we need to continue talking to the legislators, but we need to talk to everyone you could talk to, whether it's at your church, your school, the baseball games, the grocery stores, and make them aware that this is a staff, that safe staffing needs to be part of New Jersey law, because someday they're going to be a nurse, and you won't be there unless these people in the building behind us do their job. Thank you for all you do.
Thank you, Donna. Now we have a representative by such a wonderful community organization called New Jersey Citizen Action. Fight for the rights of the underprivileged and underserved. And she came out today. She is the Director of Policy and Advocacy. Do I have that right? Laura Collins-Rue. She's awesome. I want her to speak to you now, too.
Hello, healthcare labor partners. Very good to be with you today. I am an honorary member of HPAE. I got this on a picket line. So we're always happy to support our partners in labor, especially in healthcare. I'm here today as a patient advocate. As Donna just said, there should be patients, residents from all over New Jersey here. But Citizen Action and our NJ for Healthcare Coalition, which represents healthcare consumers, know we need safe staffing now, and we are here in full support of the effort to do that. The staffing levels in our hospitals are inadequate, and I don't need research. I know as a patient, as a family member of a patient, as a friend of a patient, that anytime they're in the hospital, we're always given the same instruction. When you get to a hospital bed, they tell you there's a little button on your bed. And that doesn't call the doctor or the hospital administrator or somebody on Wall Street. That calls the nurse. And it's because of the quality of nursing the patients receive that determines whether they do well or not in that hospital. And any patient who's been in a hospital can tell you that. What we want to say today is to Senate President Scutari, to Speaker Coughlin, to Governor Murphy, this is not an issue of should we do this, it's when. And the when is now. Now. We need political leadership. We need to put patients above profits, and we need to stop bowing to the whims of hospital corporations. We need patients and nurses first. Safe staffing now. Let's get it done.
Safe staffing now. Safe staffing now. Safe staffing now. Okay, we have a couple more legislators that we are waiting for. They are not here yet. They may be in their committees, but we're going to have a little more chanting. The governor's office is going to send a representative out here. The petition. Where's the petition? Oh, did everybody sign this? Did everybody sign the petition? It's going right to the governor's office. I'm going to read to you exactly what you signed, if you didn't read it. Governor Murphy, understaffing has pushed our healthcare system to the brink of collapse. This is why we need you to stand with healthcare workers as we urge the state legislature to pass a law in Trenton mandating enforceable staffing ratios. The migration of healthcare workers out of the profession is driven in large part by burnout and stress from working short-staffed. The pandemic has exacerbated a problem that existed for decades and exasperated. And it's putting our entire healthcare system in a state of crisis. Study after study shows that when Sufficient staff are working at the bedside. Patient outcomes, safety metrics, and retention of staff all decrease dramatically. And FYI, so does the cost to the hospitals. Don't let one hospital tell you it would cost too much. Think about what they're paying travelers because they can't keep their nurses. And this is in no way a put down of travelers. Travelers are nurses too, but we need our nurses to stay at the bedside. So it says, every healthcare worker and every patient is feeling the pain of short staffing. We want you to stand with us to bring staffing levels to New Jersey's healthcare facilities. FYI, did you know that ratios exist in other parts of the business world, but not in healthcare? Why is that? Profits over people. There are very powerful lobbying organizations that talk to our legislators. So we need to be just as loud and just as in their face as these lobbyists are. The hospital employers do not want staffing ratios. So, what are we going to do? We're going to support staffing legislation. We're going to set up lobby days. We're going to set up another rally, hopefully. We're going to get this thing done. And I got to tell you, fun fact. Wait, I see my daughter walking out. I just want to say hi to my daughter. Hi, Megan. She's a nurse. Everybody say hi, Megan. So today, just for the rest of today's action, please take selfies. Hashtag Save Staffing Now. Hashtag Save Staffing New Jersey. Hashtag Save Staffing Saves Lives. And hashtag Nurses Week 2023. The governor's representative will be out probably between 1:15 and 1:30 if a delegation of people who maybe drove, I don't know if you have to get on a bus, but there are people who drove who maybe can stay and present that petition. But right now, I'm going to bring up our star chanters. Oh, that's Jeff. Our star chanters, yeah. Our star chanters, Joel and Ethan.
All right, we're still here for Safe Staffing. Yes! Everybody staying hydrated. We have water, we have food. If you get food, come back. Don't leave. All right. What? Save Staffing saves lives. Save Staffing. 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 Be fair to those who care. Be fair. 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 Can we do it? Yes, we can. Can we do it? Can we do it? Can we do it? Yes, we can. Win Safe Staffing. Win Safe Staffing. Yes. I can't hear you. I can't hear you. Can we do it? Can we do it? Make some noise. Woo!